If you've ever looked at your underwear and wondered that it is a normal discharge, or noticed a change in its color, smell, or texture and had no idea what it meant, then this video is for you. Hello everyone, welcome back to my channel. I'm Nurse Wafa, and the goal of this channel is to raise women's awareness in a simple and reliable way. Today we are talking about something almost every woman experiences, and it is vaginal discharge. The first thing that I want you to know is having vaginal discharge doesn't mean that something is wrong. In fact, discharges is a part of normal female reproductive system. So today we are talking about why we have discharges, what a normal discharge looks like, what different changes can be associated with it, and most importantly, when you should seek a doctor or healthcare professional. So the first question here is, why do we have vaginal discharge? And the answer is vaginal discharge is mainly made up of fluids and mucus that's produced by your vagina and your cervix, along with shed cells and microorganisms that naturally lives in your vagina. It helps to maintain your vaginal environment and also remove your old cells. And here is something really important, which is your vagina is self-cleaning, so you don't have to use any perfumes or some special products to wash inside your vagina. So, what is a normal vaginal discharge? A normal vaginal discharge can be clear, white, or creamy, and it isn't the same every day or throughout your menstrual cycle. Sometimes it can be thin or watery, and sometimes it can be creamy or slightly sticky. Especially around your ovulation, it can become clear, slippery, or stretchy like egg whites. It's because of the hormonal changes in your ovulation, especially estrogen rising, that can affect your cervical mucus. So if your vaginal discharge changes during your menstrual cycle, it doesn't mean that you have any problem or infection. It's just a normal thing. Now let's go through quickly some common types of vaginal discharge and what they can be associated with. Number one is clear and stretchy. Clear, slippery, and stretchy is often completely normal, especially around your ovulation because of your hormonal changes, especially estrogen rising, as I said before, and it's a normal part of a female reproductive process. Number two is white or creamy. White or creamy discharge can also be completely normal, especially at different points of your menstrual cycle. But if it becomes thick, clumpy, or accompanied by a sense of burning, itching, soreness, or redness, it can be associated with yeast infection. Number three is watery discharge. Watery discharge can also be a normal discharge, especially during your ovulation or after some hormonal changes. But if it's a new and persistent watery discharge, especially with an unusual odor or pain or itching, burning sensation, it's worth to getting checked. Number four is green or yellow discharge. A significant change toward green or yellow discharge when they are accompanied with some unusual odor, irritation, burning sensation, or pain can be associated with some infections, especially STIs. It means sexually transmitted infection. So this is something you shouldn't ignore it simply, and you should consult with a healthcare professional as soon as possible. Number five is grayish discharge with fishy odor. In a grayish discharge with a fishy odor can be associated with bacterial vaginosis or BV, and it can happen when the balance of bacteria in your vagina is disrupted, so it's better to be checked by a healthcare professional as soon as possible. Number six is bloody or browny discharge. Brown or a blood-tinged discharge can be related simply to your period or some spotted, but unexplained bleeding and bleeding after sex shouldn't be ignored, and it's better to consult with a healthcare professional, and it should be checked as soon as possible. Here is the part that I really want you to remember, you've probably seen on the Google or on the social media that they're just diagnosed by the color of their discharge. For instance, white means a yeast, yellow means an infection, and something like that. But I want to say that it is not actually as simple as it seems. In fact, you cannot diagnose your vaginal discharge by just the color of it. Sometimes different conditions and different infections can have very similar symptoms, or sometimes some of the infections may have a little or just they don't have any symptoms. So if you have any discharge and you are worried about, or you have any concern, please don't Google it and ask Google to answer and to give your diagnosis. So when should you get checked? You should consult with a healthcare professional if you have any kinds of these symptoms, if you have a new strong or unpleasant odor, if you have a significant change in color or consistency, if you have a persistent or unusually heavy discharge, if you have intense itching, redness, burning or swelling, if you have pain when you're urinating, if you have pelvic or lower abdominal pain, if you have blood between your periods or after your sex, or if you have any sores or blisters around your genital area. In these cases, it is better to be evaluated by a healthcare professional as soon as possible. There is one important tip that I really want you to know, that please don't use a douche or any perfumes or scented products inside your vagina, because they are unnecessary and they're just irritated inside your vagina and can interrupt it with the normal and natural pH of your vagina. The gentle external cleaning is enough. Your vagina doesn't need to smell like perfume to be healthy. Your body always constantly sending you some signals, and when you are trying to learn what is a normal, you can understand and you can recognize the abnormal situation much more easier. And the goal of this channel is to raise your awareness and help you to understand your body a little better. At the end, I want to say that this video has just educational purpose. It can't be replaced by medical advice or medical examination. If you have any concerns, if you have persistent vaginal discharge, please talk and evaluated with a healthcare professional as soon as possible. Thank you so much for watching my video. If you think that someone may need this video, please share it, and don't forget to like and subscribe my channel. I will see you in the next video. Bye.